Today we have Dr. Josh Fisher, who's one of my best friends a long time. We've known each other for over 10 years, which is crazy to me in one way, but he works now for Bayer Crop Sciences. He works in Chesterfield, but he's done a lot in his career. He's studied Lyme disease, he's looked at the plague, he's done a lot of work in microbiology, but also in toxicology. Spent a fair amount of time looking at environmental fate and doing risk, and then now is doing work specifically in looking at risk and doing risk assessment. So I was excited to have him here today. I thought instead of having Mr. Hovler or I drone on about risk assessment and stuff in the textbook, we can get one of the world's experts here, a subject matter expert, to just talk about it and go through some of this with you guys. So we're excited about this opportunity. I wanted to start out. There's a lot of misconception. The word risk is a really loaded term. The word safety is also a really loaded term. I wanted to see if you could help us navigate this space, that safety isn't a terminal space and risk isn't a terminal space. It's kind of a continuum. And how do we determine and understand what a risk is versus what something that's safe? And so, yeah, that's kind of where I want to start. Just talking through, what does a risk assessment look like? That's the core piece of what your job is. So if you can tell us a little bit about that process of determining what is risky, how do we know what the risk of something is, how do we compare it to other things in terms of risk versus safety, that kind of stuff.
Okay. Happy to. Thank you. Welcome to be here. Basically, one of the core tenets that I'd like to just introduce as part of our discussion, if you remember nothing else about my visit, risk, you can really break it down into two components. You need two pieces of information to determine risk of anything, whether it's product or a chemical or anything you want to know. Risk is defined by its exposure, both the duration, how much of it, how, when, and as well as its hazard. What effects does it cause? You need to have both pieces of information to be able to determine its risk. An example, a real-life example about why we only typically get pieces of this, I used this example in the previous group, I think it was a good one, was if you either read news online or you hear something on the radio, how often do you hear someone cite a study that if you eat chemical A or if you're exposed to this, you're going to get cancer? Oh, you hear that, right? Pretty frequently, right? Something's been associated with cancer. You're hearing part of the risk story there. That's the hazard story. Someone's done a study somewhere that said, eating a certain type of food or, being exposed to this type of product led to some increase in incidence in cancer rates. The part that you're missing is the exposure piece. Well, how much did they have to consume? In what quantities? When? What types of people? Or, what organ? Maybe it's not people. Maybe it's organisms in the environment. So you have to have both to really determine whether or not you should be worried about something, right? And so that's what risk assessment is. Risk assessment is a series of studies that look at both sides of that equation. At Bayer Crop Science, I work mostly on biotech products, genetically modified crops, but I also worked some time in the chemistry space as well. The process is the same, and it's the same whether you're talking about human risk to humans, or risk to the environment, and particularly beneficial species that we care about. And as a way of introduction about how that works, it's all driven towards a goal. And that goal is defined not by scientists, not by companies, or professors at universities or anything. It's defined by us as a society, and those are protection goals. That's basically, what do you care about? What is it that you want to protect? And just to think of some common examples, what that might be, certainly, human health. That's something I think we all agree we care about that. That would be a protection goal. If you don't want any adverse effects to human health. Beneficial organisms in the environment. You don't want to affect monarch butterfly populations, let's say, or honeybees, or some endangered species in general. These are IDs, these are protection goals. These are things that we care about as society. And so all the studies that you need to do fit under that. You're trying to demonstrate that your protection goals are met, that you're not adversely affecting either humans or species in the environment that you care about. Once you've done that, that basically lays the groundwork for what studies you need to do. So I work in the environmental space. So we're mostly concerned about beneficial species in the environment, organisms that perform important services, whether they're, cycling nutrients in soil, or whether they're pollinators like honeybees or butterflies, or whether they're beneficial predators, they're organisms that eat pests. Those are all species we'd want to protect and not harm in the agricultural ecosystem. So based on that, we do our studies to determine whether or not those organisms are adversely affected. And from a process standpoint, what you do is it's a stepwise process where you take your product, you take its proposed use, and from that, you then build what's called a conceptual model. You make predictions as to what organisms would be exposed to your product. If it's a sprayable chemistry, what organisms would be present in a field that could be sprayed by that chemistry. If it's a genetically modified crop, and that pollen in that crop is producing a protein, and a honeybee comes and forages on that pollen, how much of that would they get, and what timing, and things of that nature. From that, you can determine what organisms you need to worry about from in the environment. What organisms do you need to test? Once you've decided that, you basically run a series of laboratory tests where you expose your species to different concentrations of your product and determine whether or not there are any effects. If there are no effects, you can basically make the conclusion from that the use of your product is unlikely to harm that species or affect that protection goal. If you do have effects, then you need to find out at what concentration does it cause an effect. And effect could be like, for example, on the species survival. It could be on its growth rate. It could be on its reproduction capability. All these things that could affect that population in the environment. Once you know a concentration that affects that species, you then compare that to exposure. How much of it is it out there? How much is that protein expressed in pollen? Or how much are you spraying on that crop? How long does it persist? Where do you use it? When? And once you know how much of it is out there, you can compare that mathematically to how much causes an effect. If the amounts in the environment are significantly lower than that needed to cause an effect, you can presume minimal risk based on how that product's used. If not, if, for example, the amount in the environment is higher than what might cause an effect, well, then you have to go into what's a step called risk mitigation, where you might have to put limitations as to how your product's used so that species isn't affected. That's kind of a long-winded story, but that is the process of how you go about generating studies to determine the relative amount of risk that your product poses. All of our data, from a standpoint of how this works, you can't sell a product, a pesticide, in the United States unless you have approval from the Environmental Protection Agency. It's their job to evaluate our studies and evaluate our risk assessments, and then they conduct their own assessment to determine whether or not they deem your product is appropriately safe for use. And basically how that works is we submit our studies, they evaluate them, they determine whether or not the studies are sufficiently done, whether or not there's any gaps in our studies. For example, maybe we didn't test a particular species that they're particularly concerned about. They might ask for more data, and it's a back and forth until we've generated enough data to satisfy the agency's concerns. And once those concerns have been met, they will grant an approval and appropriate use restrictions on that product.
We didn't talk about this in the last group, but I think it's kind of interesting. Like, the EPA's objective is to take these opinions that exist in our society and then translate that into scientific targets. How do we know what we need to measure and that sort of thing? So society and policy is driven, and then those scientists put out and do the studies. But what's interesting about it is there's a human impact tilt to it, because we're trying to limit, whenever we're doing new activities or using new chemicals in the environment, it's all about, well, we want to limit changes that the human impact, which is actually a really noble thing that we didn't think about in previous generations. It's a great thing, but there's nobody doing a risk assessment, for example, on what is the carcinogenic capacity of tree sap or things that already exist
Correct.
in the environment. It's all, so I just think it's interesting because you've talked a lot about products and chemistries and things that people are making, and the reason that we're doing studies in that is because there are new elements that are going to be introduced to the environment, and I wonder about how many risks are introduced in the environment that aren't even studied because they're not, whether they're practices or things that aren't products,
Right. So so that raises an important point, and something we didn't discuss before, that a lot of the analyses are based on a notion called history of safe use. Okay? So basically what that means is that if you take, for example, a corn plant that expresses a protein that kills a certain insect pest in it, what you compare that to is a corn plant of the same genetics that doesn't have that protein. The reason is that corn, generally speaking, without any changes that we've made in terms of specific gene insertions, is considered safe. An ungenetically modified, that's a loaded term. You want to talk about a loaded term, but a corn plant for which we've not made a specific insertion event in, that's been grown for millennia by humans, and it's presumed safe. And so that's your comparator. And so a lot of the safety assessments are based on that. If there is not a significant difference between regular corn, which is presumed safe, then you can make the conclusion that your new version of corn is just as safe.
Yeah, it's important because there's no real thing as safety. It's as
right.
safe as something that already exists, which is kind of a big idea. It's
right.
a big theme in risk.
And then the inherent piece of that is that I would not recommend to anybody to go out and just start eating a 100% diet of corn, right, as 100% of your diet, because we know that any food product that you would consume, doesn't matter what it is, carrots, corn, whatever, if that's 100% of your diet, you're not going to be that healthy, right, because each food has its limits in nutrition. So, the old frame is the dose makes the poison, as it were, and so even foods that we presume healthy, there is a theoretical toxicity limit on it. Mm-hmm. There is an LD50 for carrots, believe it or not.
Mm-hmm. This is a big thing that I think about a lot because there's a lot of misconceptions. On the packet, on the first page, everybody has access to that graphic, and the statement on the right side of that graphic, I think, is really good. How do we determine what risks are? Our public perception of what risks are totally usually wrong compared to what the true risks in our world and in our environment actually are. So in that big graphic, it shows heart disease. It's the leading cause of death in the United States. And we talk about heart disease some, but we don't give it as much justice as we should, given that it's the number one way that people die, and it's a huge risk, right? It's a big deal. I think about this a lot because it shows up in current events, and with vaccinations is a really good recent example, right? People in the scientific community are shocked, and I'm equally shocked, when we find something like salmonella on one batch of lettuce that comes from California. We go through every supermarket in the United States and trash all the lettuce, and they go to those fields and they incinerate it all, and there's a period of time for sometimes months where nobody gets salmonella, or nobody takes any lettuce because they're worried about this risk about salmonella. But then at the same time, we have those exact same people making choices like we're not going to vaccinate children because of some perceived risk that might exist associated with vaccines, even though the risk of meningitis or measles or other disease-causing agents is way more than this exposure to salmonella. And I just wonder, how do we reconcile, or how does the public get educated in the right way? What are the big misconceptions around risk and choices that the public is making?
Right. So, risk focuses, one piece of it to think about is risk really focuses on only one side of the equation, right? It's really only looking at the downside. When EPA, for example, makes a registration decision, the part that they also incorporate that we don't talk about is the benefits piece. So, every new technology that comes to market has a risk side and has a benefit side. You can look at vaccines, for example. Risk is never zero. It's just not. Risk of anything is never zero. That's a tough thing for people to deal with in general. Even if you run a bigger risk of getting in your car and driving to school or work every day than anything out there, it's never zero, right? And so we struggle with that. But when they're looking at a benefit side of it, for example, for a vaccine, well, the alternative is that disease and the mortality and morbidity associated with the presence of that disease. Yeah. Very clearly, as I say, we've made the decision that controlling a terrible disease like measles is more important than knowing that we can't ever get to 0% risk. And that's true of any product. You can take, an insecticide, And you could say, well, maybe we have some concerns about it. Let's ban the insecticide, like Europe banned neonicotinoids, classic chemistries. They banned it because of some concerns over honeybees. Well, the problem is, the downside and what they don't talk about, okay, they banned it. Well, it's not like farmers just didn't use insecticides anymore. They've gone to the older chemistries, which are more toxic, have worse use patterns, and have worse environmental impacts. Mm-hmm. But the decision was made only looking at the risk, not at the benefit. And so I think in general we tend to look at the worst case. It's very easy to communicate the risk. The benefits are not as direct, particularly in the agricultural space. The benefits to a farmer don't face the consumers. So the consumer, when you're buying something on the shelf and you're thinking about pesticide, you're only thinking about the risk side. You're not really thinking about what the benefit did, and it's not clear to the consumer the alternative if that, for example, that chemistry wasn't available, mm-hmm. what would have been used. So that's a difficult communication bridge sometimes, particularly in agriculture.
Given that and your perspective of having worked in this field both on the disease-causing side and the toxic side and working in the agricultural industry space, in your opinion, what do you think are some of the biggest risks currently facing our society? And we'll just constrict that to us in the United States,
sure,
or this population, to human health. And then what do you think are the biggest risks to the environment that exist?
I think for me, one of the biggest ones in general is climate change, in part because it's unpredictable what the true ramifications are going to be. Mm-hmm. As a company and as an industry, we're definitely, trying to. It's hard to develop products knowing what those challenges will exactly look like. How is our local environments going to change? What types of new pressures will that be? As the climate change, how does that affect, weed and bug pressure, which is the two principal drivers that pressure agriculture? How does that change? Warmer climates tend to be more insect pressure, tends to be more weed pressure. They become more difficult to control. But then again, where are those environments going to be? What parts of the U.S. are we going to be growing crops in parts of the U.S. that we're not now? Mm-hmm. And what are the challenges that go into that? So I think that's a big one because it's tough to anticipate what those changes look like and how you develop tools to be able to meet those needs. Mm-hmm. That's a big one.
Good. I want to make sure that we have enough time. Last time we ran out of time for questions from the group. I have all kinds of questions. We could talk for ages, but I just want to open it up. Does anybody have any questions that are burning on the brain? Anything that's come up as we've been having our conversation here? Sure.
So you talked about how risk and people's perception of risk seems to be taking a great toll on how the general populace reacts to things such as vaccines, which was the major example of today.
Yeah.
Do you think we could be able to use the media in any way to kind of play a role into delivering the comparisons of risks?
Yeah.
If so, how come they haven't really done these sorts of things?
Oh, there's a lot of drivers. The second part of your question is a tough one. Why haven't been done? I would say there's multiple layers to that. So part of the challenge we run with when we talk about how science is communicated in general is the idea that you're really only getting a piece of the story. For example, I talked in the beginning about how the example, you'll see a study that such and such chemical A is associated with cancer, right? That's what you see, but you don't hear about the exposure side. You also see a lot of studies about exposure that say found traces of chemical X in cereal, or that, and all of a sudden that, people alarm. Oh my God, okay, it's in my breakfast cereal. But again, you're only getting now the exposure side. You're not getting what they don't tell you is, well, you'd have to have, 10,000 pounds of breakfast cereal in your morning to reach the toxicity threshold. So you're only getting part of the story. And in part, that could be whether that's just to, deliver clicks for a media standpoint or what, I'm not sure. Certainly from a standpoint of an industry, I'm going to be self-critical of our industry. Historically, we haven't done a good job of, one, communicating benefits, why the technologies are useful and why, we think they're important. The other thing we haven't really done a great job is talking about how the products are evaluated. It's only been in really the last 10 years that working in my part of the company, which is really the product safety, where we've been promoted to publish our work and get it out there. I think the industry was slow to come around to the fact that the public wants to know how these products are evaluated and have confidence about the amount of work that goes into demonstrating these products that are safe. The number that gets floated around. So, for example, for a genetically modified crop, it takes 10 to 12 years to go from product development to market, and about $150 million. 60 to 70% of that time and money is spent doing safety studies. And that's just because it requires the bar to demonstrate acceptable risk is extremely high, particularly in our country, and that's a good thing. That as consumers we should have confidence in that. But that's something that most people don't know. Whether it's an industry chemical, whether it's a soap on your bathroom sink, whether it's a pesticide or a product in chemistry or in agriculture, these products all go through the same type of risk assessment process, and it's very robust and thorough. And it costs a lot of time and money. And I don't think people necessarily have an appreciation for that in general. What can we do about it? Certainly as a company, we're trying to spend more time, publishing and getting our studies out there for people to see and to, speak at avenues like this to share, this is what we do. It's not a big secret. All the data that I generate, for my studies ends up being public.
Yeah.
And so that's a piece of it. But I think we're kind of late as an industry coming around to that.
It's kind of weird because a lot of times scientists become victims of their own precision language. You don't want to make claims about things that you haven't seen evidence for. But if you're somebody who's just talking about a subject, there's reckless abandon to just make any claims that you feel like you want to make. And it's my opinion, and it's you're free to state your own opinion under laws of expression. But scientists are bound by like this other code of, well, you could say whatever you want, but you're only going to say things about science if you've seen evidence. So sometimes we've painted ourselves into a corner as a scientific community. One other thing I think about a lot in this subject matter is, in your generation, more than in our generation, the science and the topics that are being talked about are becoming more complex. So you could talk about genetic modification, gene editing, climate change. These are all really difficult subjects to understand, and the gap is widening between the people who have to make decisions about those subject matters and those same people's ability to understand, because they're so complicated. Right. So that's why what we do in education is so important, that we have to make that gap as minimal as possible between the public's understanding about what the science and what the data tell us and the decisions that have to be made. That is a huge charge, and it's important, but it's hard to respect when you're a young person. Oh, I have to sit through this science class. But you may have to make decisions about climate change or scientific bioethical things in your future. I don't know what the future has, but it's a big topic. Yeah?
Specifically about genetically modified crops.
Yeah.
Why is public qualitative assessment of that? Why do people think this is so?
It's a good question. This came up before too. First of all, I'll set the example with that one. There's a lot of topics where if you poll scientists and poll the general public, you'll find general agreement. 90% of scientists believe in climate change. Public is, by and large, you can find sects of public that's close to that. Vaccinations are safe. Definitely general public agreement to that. But there's a big discrepancy when it comes to genetically modified crops. You poll over 95% of scientists say genetically modified crops are safe. It's a lot lower in the general public. Part of it is there's a barrier. Part of it, there's a layer between the businesses that develop the technology and the end-use consumer, right? And that's the farmer. Those products were developed and designed to help the farmer. And I can tell you, plenty. There were times in the industry in the past where people basically just said, it doesn't matter what the consumer thinks because they're downstream. It's the farmers we need to convince that they want. That was kind of a bad opinion, I think. I think that's probably not very smart. We've gotten smarter as an industry that no, you have to look at your entire consumer chain. And I think what it comes down to is what we did a very poor job is understand, well, why were those technologies important and what benefits did they actually provide? So, you buying, corn or something that was fed on a genetically modified corn that had a BT protein put in it to kill insects. Why do you care? You know, it's not as clear when you're at the grocery store why that matters. Well, what the reality of is what that technology did is it replaced a chemical insecticide. Chemical insecticides have a history of being, more toxic, more side effects, not as specific, more environmental impacts. But who knows that, right? I mean, the farmer knows that because they realize, okay, well, I don't have to spray and I'm saving money and I'm getting all these benefits. But the consumer doesn't see that. And so it's been a late coming to the table of industries and academic scientists who work on developing these types of products, because these products come out of universities as well. But communicating, well, what are the benefits? Why is this important? And how does the consumer benefit? Because they do benefit from it, but it's not clearly communicated historically. So I think there's some catch-up.
We talked about like the GMOs being tested for like 10 to 12 years.
Yeah.
All my thinkers into that. I think all that's necessary. Are there extra regulations
Some of it, I would say, here's what I'd say. It's a lot, but at the same time, you could argue here and there that certain studies probably aren't as necessary because at the end of the day, the GMO, what we're putting in is a protein, and you eat proteins in your diet every day, and it goes in your stomach, gets digested. So some of the higher order toxicology studies of mammals and birds and stuff, you could argue scientifically that they're probably not necessarily, we have a prediction of no effects. At the same time, getting back to this previous question, how do we build confidence to know that these products are safe? Sometimes it means doing the obvious study. Look, we're going to feed this to a bird species. We don't expect there to be any issue, but we're going to do it to demonstrate that our hypothesis is correct. And so sometimes the experiments come across as obvious, but I think it lends confidence. And I think at the same time, while we do a ton of studies, the requests we get and our interactions with the agencies, the studies we have to do are reasonable. They're based in science. And you may disagree with certain interpretations, between a reviewer who's looking at your science. There can be disagreements between what we think is, appropriate level of testing and the agency might think, they might disagree. But it's all grounded in the scientific method. It's hypothesis driven. And I think that's all you can really ask for, And so at the end of the day, I think it's a lot, but it's not unreasonable. It's not like just making up studies to do studies.
I think it's a really important question, though, by the way. And it's a question that our society needs to ask a lot more because we want to make sure that things that are going out into our world are safe. But the same thing is true in the pharmacology space or pharmaceutical space. It's a huge burden to overcome. It's a huge amount of money and it's a lot amount of time. And so the number of innovations that can make it over that hurdle is pretty low. They have to have a huge return on investment for companies. You have to know that it's still going to work in 10, 12 years. So it constrains the number of things being studied and the number of innovations that are being advanced. And I'm not saying the studies aren't important. They are really important. And we need to do those studies, but who needs to shoulder the burden? Is that something that the government needs to do versus something that a company needs to do? I think these are good open questions to think about because we want to continue to make advancements in our society. And if we ratchet up risk assessment to some huge level, then we can no longer create new products that may actually help human health or help the environment. For example, of these crops, or they could reduce the number of pesticides being used. That's a beneficial state, but it may never be able to meet the acceptable criteria for risk assessment. So it's definitely a balance. I don't think we have a good answer for what that balance is. This is just me making my own opinion. I don't think the balance is good right now. I think there needs to be more time spent on finding what that balance is and focusing on it.
And a specific tie-in to that point, which is the downside to the question you raised, is the downside to, having a robust safety assessment like that is that, given the associated time and cost, only the largest companies can really go through that process. So what that does is that really diminishes the number of small companies that can really participate and develop technologies all the way through the safety studies. And so that's a downside to that. And so again, it comes back to what is that balance? Thank you. What is that balance that we have confidence we're generating safe products, but yet isn't such a cost burden that only the largest companies can do it? So
we are doing a pretty good job in this space too, by the way. Like our summer reading on DDT that we've talked about a lot. At the time when Rachel Carson wrote that in 1962, none of this infrastructure and this thought process and stepwise fashion of doing these studies and getting approvals, none of that existed. And so we had this problem where there was a toxin and there was biomagnification and bioaccumulation, and it caused a huge amount of harm in the environment. We had a lot of concern. So now the pendulum swung in an appropriate manner to help deal with that as an issue. Mm-hmm. And so now we just have to figure out how do we still deal with that as an issue, but continue to make advancements in our society. It's a big thing, and there's scientists on all sides of that. There's scientists who are working on discovery. There's scientists who are working on risk. It's all important work.
Yep.
For sure. What else do we have? Yeah.
We talked a little bit earlier about producing meat from only one cell.
Yeah.
Do you think there's a greater risk in that, or is it about the same? Or just eating?
So I can't answer that question, but I can tell you how the evaluation would look like. Mm-hmm. So it gets back to the notion of history of safe use. And basically, if you have, for lack of a better word, conventionally raised meat, you would compare your new product to that. You'd look at composition. You could do some type of dietary, animal feeding study. Excuse me. And you do that type of comparative analysis. And that's how you go about evaluating that type of product.
Biofabrication is an amazing thing, right? It's an exciting invention. People don't know what that is. Like the lab-grown meat, it's a cool technology.
Yeah. Something like that, I'd have to I think the first question, would that even be regulated by an agency? I'd have to think about that one. Yeah.
What else? We probably got time for one more question, and then I want to touch on a couple of career things before we go. What else? Yeah.
What can you do with your life? What do you study most often?
I'm sorry?
What do you study most often?
Excuse me. Most often, so I work on biotech products. Most of the time, I'm looking on products that, like, for example, kill an insect pest. So I'm managing studies and running studies to determine, what does that protein kill? What does it not kill? And is it, are protected species not affected? So we want to make sure that, like, beneficial insects, honeybees, protected species are not adversely affected by that protein being produced in a crop. Those are the type of risk assessments I work on mostly.
This came up in the last group, and I'll just mention it here again. It's a major thing to know and memorize AP-wise, the Endangered Species Act of 1972. We have to protect endangered species. If there's a new product, you have to do these types of risk assessment to make sure that they don't cause any adverse harm to endangered species. That's a big thing. It's a key legislation that we've talked about. Mm-hmm. Just to close the time, we have a lot of people here who maybe end up working in STEM fields or not. But I think the interdisciplinary, we're increasingly moving to a space where you have to understand and work across science, technology, in the humanities, and business, and think about all of this together. You've had a pretty prolific career in a bunch of different areas. Mm-hmm. What would be some career advice and academic advice that you would want to give the group? Maybe like 3 good things. I don't know.
I would say, at this point, as you finish school and then head off to college, you're exploring areas in science. The area of science that, if you pursue that route, isn't as important as learning how to think critically, how to be able to read something and evaluate it. Because I've been able to jump around in different careers. And what carried me through that is that ability, be able to, know how to design an experiment, be able to read an experiment and know if it's a good experiment, how to basically become just generally scientifically literate. Because I've been able to move, like I said, move from microbiology to environmental sciences. We didn't talk about this, I did an 18-month doing, drought corn studies in a greenhouse. And if you'd see my garden, I can't grow anything. But I was able to pull that off because I was able to know what a good experiment looked like and what good science looked like. And so if you know that, you can do pretty much anything you want in science, and you can feel free to move around and explore anything that you're interested in, and feel free to change it up at any time.
Yeah, for Sure. Anything else from the group here? All right, gang. So have a great weekend. We'll see everybody again on Tuesday in your spaces. Don't forget the reading, man. I'm just going to try to